Well, I'll give the floor now to the next speaker, who is Mr. David Antwi Ofori, Head of Operations, Accra Digital Center, Executive Director, Ghana Oracle Digital Enterprise Program. You have the floor, sir.
Thank you very much, and good afternoon to everybody. And yes, I'm currently under isolation in England because the borders of Ghana was shut. So when I was out of the country, but yeah, it's Corona has of course helped the world to realize how more collaborative we need to work together, because that's the only way we can win. So of course the science is important, but our collaboration is much more important as well. And I just want to share a few thoughts on what Ghana's own strategy has been. Of course, Ghana has worked very closely with WHO to be able to fight this pandemic. And Ghana's strategy was quite early, which is why I'm stuck out here, because the borders were shut. I think it was one of the first countries to shut its borders to be able to contain and also have a mandatory 2-week or 14-day quarantine for all travelers coming into the country. And in fact, that cost was borne by the government to put them in accommodation and make sure that they test them to ensure that we keep the virus under control. And I think that strategy has yielded some very, very fruitful results, for which reason even Ghana's own partial lockdown was put in place for 3 weeks and was lifted. Currently, Ghana's case count as we speak stands around the neighborhood of 5,408 positive cases. And this is out of the over 170,000 tests that have been conducted. It is worth noting that Ghana currently has one of the highest per capita tests on the continent. Ghana's test has been very, very robust. Unfortunately, we've had about 24 fatalities. But again, that compared to the overall positive testing meant that our data, our fatality data is significantly low. We're not resting on our laurels on that, because majority of the positive tests are also showing asymptomatic, which means that you run the risk of them infecting other people unknowingly. So Ghana is pushing very much with its surveillance testing. And fortunately for us, the 3-week lockdown helped the country to identify the hotspots. So Ghana knows that, of course, the capital is the epicenter of it all. But then other areas within the suburbs, other suburban areas and other inner city dwellings have much more of the positive cases. I would say that of all the positive cases, we have just about 12 people, actually we have 6 people who are mild to critically ill. There's nobody currently on a ventilator in Ghana. So that's something that the science has to still lead us to find out what is being the cause of this data. Of course, recently, our R0, which is our reproductive rate, has gone up because, of course, the lockdown was lifted. So our R0 is above 2, approaching 3. But the positive side of it all is that Ghana is also deploying technology tools to be able to fight this. I run in the Ghana Accra Digital Center. We have one of our laboratories teaming up with INCAS, providing their own test kits, rapid test kits, which will be used in terms of testing more people. Also, Ghana is the first country to deploy our drone technology to be able to collect samples and deliver samples on time. So that has helped the test centers to test more samples, even from remotest part of the country, because we were using the drone technology to deliver essential medical supplies, but we had to retool them to help fight COVID-19. So that has been one of the success stories as well. But again, our innovators have built capacity locally, which meant that whilst, of course, the whole world is scrambling for PPEs and other things, but Ghana is proving to be a bit self-sufficient with its own PPE manufacturing. So even within my jurisdiction in the digital center, we have 3D printers that can print face masks and head masks. Also, the local entrepreneurs have also capitalized on it, of course, with encouragement from our president. And now they are showing majority of face masks are also in Ghana. Ghana has its own sufficiency in hand gels and sanitizers. So as a country with the borders shut, you can imagine nothing can come in. So how are you going to maintain these things? And our anthropology as a country meant that we have a lot of people, we have a significant part of the population, especially in the capital, living in areas that social distancing and self-isolation protocols are very difficult to observe. And so you have to deploy things like mobile technology masts to be able to trace cell phones that have come into contact with other positive cases. Of course, Ghana has also launched its own tracing app, which meant that the citizens can actually download the app. And in fact, the app actually was even launched when it wasn't even permissible on Apple Store and Play Store, but now they are on Play Store and Apple Store, so that again the category of citizens who can use the app are feeding the data in, which is going into the national database, and the COVID-19 task force is analyzing that data as well. We are also deploying other, non-internet-based technology like USSD for people to actually be able to text in, because I think earlier on in our discussion today, we saw the essence of having connectivity across a country and even across the world, to be able to allow data flow. Because if some part of the world haven't got access to the internet or data, then how do we share data on COVID-19 with the speed it deserves? So we use other USSD technology to be able to get data out quickly. And then we have national emergencies, which we deployed, emergency lines, which we have deployed to be able to fight this pandemic. I must say that the scaling up of some of these rapid test kits have proven very, very successful, because all the materials and everything that is used for the test kits are sourced locally, which meant that there can be that self-sufficiency to be able to scale it up quickly across the population. When it comes to financial inclusion, for instance, I mean, there are a chunk of the population who hitherto may have to do transactions using cash-based transactions, but of course we know that the virus can spread with the movement of cash. So there are other financial inclusion tools. Of course, Ghana is very heavy on mobile money deployment, which meant that the underserved communities can rely on this technology to be able to do cashless transactions at very with all the convenience and all the speed that it requires. Some of the beneficiaries of our citizens who depend on, soft loans and micro loans from government, there's a new digital platform that has been launched for them, so that they can actually get their loans onto their mobile wallet without having to interact so much with people. And all this is aimed at stemming the spread or the people-to-people interaction. So as a country, these are some of the back-end technological things. Of course, my job working with a digital center is putting together, calling on young innovators to come up with other tools that can be used in the area of machine learning, AI, blockchain, to see how best we can use technology to also not just fight the virus presently, but even post-corona, how do we change the model of working? How do we change the way businesses relate with each other? How do we change the way people work in their office spaces? So these are some of the things that we are pushing within the digital center. We currently even recently launched a solar-powered hand washing stations, which meant that, again, that is also reducing the risk of infection, because then you don't need to touch any button. Everything comes up automatically and is all timed up within those hand washing stations. So as a country, as a developing country, yes, we have a number of developmental and economic challenges, but these are some of the things that we're doing that has enabled the country to be able to even scale back its lockdown and allow the citizens to get around doing some economic activities. Of course, there are protocols in place to limit how many people can converge in one location, things like funerals and weddings and parties. Those restrictions are still in place, but overall, people can get by to do their own economic activities, because you would appreciate that even with countries like the US or the UK, it's costing the treasury trillions of dollars and pounds just to keep people at home. And Ghana is not in that position to be able to, if you like, pick up such a bill in terms of allowing people to stay at home. And sometimes, I must admit that sometimes even the data on all the citizens to be able to make such judgment call is difficult to get exact data and exact science. So, you know, I would say this is what we are doing as a country. Of course, it's been a wake-up call for everybody across the world, both advanced countries and developing countries. And I would say that Corona has found a way to, if you like, shake things up for countries to wake up, to look at how can we best collaborate more, how can we follow the science a bit more, pay attention to the scientists, and also even look at self-sustaining protocols and capacity to run our own governments and serve our people better. But certainly, we in Ghana, we are not relenting on our efforts to push the robustness of our testing, because that is more important. Important thing is you test, so you can actually trace and isolate and get people to. I would say that if you look at our data, our recovery rate is a bit on the lower side compared to the global recovery rate. We're still hovering around 10%. However, over 85% of our positive infections are in mild and asymptomatic bracket. So I don't know if there's any, I'm not a scientist, so I don't know if there's any cause to that, why we have majority of people in that bracket, yet our recovery rate is still hovering around 10%.
Thank you very much, David. It's very inspiring, and certainly it represents a series of examples of what things are successful to do and reproduce in other countries, and your experience is very promising. Thank you very much.